Problems in diastolic function assessment. Tau measurement revolutionized our approach to diastology. This video was inspired by a post from the web. Hi, I am a proud father of two beautiful girls. In my 40s, moderately overweight yet healthy. Recently, went to the doctor's office for shortness of breath and got the diagnosis of severe diastolic dysfunction, heart failure with preserved ejection fraction. Really shocked to know I might have only 5 or 6 years left. Surfing the web, even more confused. Anybody tell me what the fuck is heart failure with preserved ejection fraction? I don't want to die. Please help. To be honest, the definition of heart failure with preserved ejection fraction is not easy even for a clinician, since it is keep changing in recent years. The combination of severe diastolic dysfunction and heart failure with preserved ejection fraction is suspicious. Left ventricular diastolic time constant, tau, is the most established index to describe diastolic function. Measurement of tau revealed another story. Tau measurement suggested systolic function and diastolic function are pretty much matched. Diastolic dysfunction is the same or a little bit worse than systolic dysfunction. For example, if the patient's systolic function is normal, the diastolic function supposed to be normal, mildly or even moderately decreased, but, to our knowledge, doesn't go that far as severe diastolic dysfunction. Since diastolic dysfunction is always worse than the corresponding systolic dysfunction, if there is severe systolic dysfunction, the diastolic dysfunction supposed to be always severe. ASE, American Society of Echocardiography, published 2 diastolic function guidelines in 2009 and 2016. It has dominated the clinical practice ever since. A few researchers had expressed their concerns though. Today, the guideline is still the lighthouse of diastolic function assessment for the whole world. With the rising of pragmatic tau measurement, serious concerns emerged. Fact is, quite a few patients with normal systolic function were diagnosed with severe diastolic dysfunction by the guideline. The patients could be prescribed intensively to treat heart failure with preserved ejection fraction. Or even got invasive procedures like left atrium to coronary sinus shunting device installation. The diagnosis could be wrong in the beginning. Another confusing scenario is patient with severe congestive heart failure, EF less than 30%. Echo diagnosis is mild diastolic dysfunction according to the guideline. Sometimes, echo could even suggest normal diastolic function. Anyone with basic knowledge of cardiac function can find it an unrealistic combination. It is against the common sense that diastolic dysfunction comes earlier than systolic dysfunction. Time to get the guideline updated to serve the patients better. Next problem worth mentioning is indeterminate in so many circumstances while the diastolic function is always there to be assessed. And there are some other moments when the guideline simply gives up the assessment, like in patients with atrial fibrillation, E-wave and a wave merged, or severe MAC. Why weird diagnoses come out of the guideline? Because all the active indexes are indirect descriptions. On the contrary, tau is directly related to how powerful the cardiac muscle is during early diastole. That is why all the top echo textbooks agreed tau is the best index to describe diastolic function. Hopefully, tau can be part of the guideline in the future. So, at least we are safe to say, diastolic function assessment without tau is like perception of the world with one eye closed.